What steps should I take to minimize the risk of infection during self-insemination?
Hello and welcome to our discussion on self-insemination. This video aims to guide you on how to minimize the risk of infection during the self-insemination process. We'll go through this step by step to make sure you have a safe and successful experience.
Why is minimizing infection risk important?
To begin with, it's important to understand why minimizing the risk of infection is so crucial. Infections can lead to discomfort, fertility complications, and even serious health risks. By taking preventive measures, you can ensure a safer and more successful self-insemination process.
What materials will you need?
The next important step is understanding what materials you'll need. These may include sterile cups for semen collection, sterile syringes, without the needle, for insemination, and gloves. Remember, all the materials you use should be brand new and from a reliable source. It's crucial that these materials are sterile to avoid any potential risk of infection.
What is the proper preparation?
Proper preparation is key to reducing the risk of infection. Make sure to clean and disinfect the area where you will be conducting the procedure. Personal hygiene is also of utmost importance. Wash your hands thoroughly with an antibacterial soap before and after the process. Using gloves could provide an extra layer of protection.
How to handle semen safely?
When dealing with semen, avoid direct contact. Use the sterile cup for collection and the syringe for insemination. It's also essential not to let the semen come in contact with any potentially contaminated surface.
What are the steps for safe insemination?
For the insemination process itself, here are the steps. 1. Collect the semen in a sterile cup. Make sure there is no direct contact with the hands or any other object. 2. Draw the semen into a sterile syringe. Avoid touching the part of the syringe that will come in contact with the semen. 3. Insert the syringe into the vagina. Avoid touching any external objects or surfaces with the syringe. 4. Depress the plunger to release the semen. This should be done slowly and calmly. 5. Leave the semen in place. Do not clean internally immediately after insemination. Remember, every step here is crucial and should be carried out with utmost care and cleanliness. Reducing the risk of infection during self-insemination is vital and can be achieved with careful preparation and practice. Remember to use only sterile equipment, maintain personal and environmental hygiene, and handle semen safely. We hope this video has been informative and helps you in your journey. Please consult a healthcare professional if you have any doubts or experience any discomfort. Stay safe and healthy.